Mental health. Let's talk about two particular types of health conditions. One is avoidant personality disorder and the other is oppositional defiant disorder. I love when people ask me about specific conditions because let me be blunt when I say this. There is no slam dunk medical condition. Well, stop for a second. There are very few slam dunk medical conditions that are just that, because they don't just look, just because you have a diagnosis of it, like for instance, because somebody asked me about avoidant and somebody asked me about oppositional. I said, well, let me give both. Avoidant personality disorder is, look at the name. It's that basically due to this disorder, you have a desire and interest in avoiding individuals and dealing with people. So then, the same thing with oppositional defiant disorder, meaning you tend to be confrontational with people on a regular basis. And you would say these are kind of types of people who you probably don't want to have interacting with the public. So you would say to yourself, what kind of work? There's no work that can be done because you got to work with the public. Well, there are plenty of jobs out there that does not require you interacting with the public. Well, what about employees? You couldn't work with other employees. There's jobs out there too that you can do. And you say, well, name one. Surveillance systems monitor, where you're just sitting in front of a monitor. You see something. If you see something scary, you call your supervisor. Okay, that's one. What's another one? There's some warehouse worker jobs. If you're working in a remote warehouse security job, all you're doing is walking around, making sure there's nothing out of place. Especially if you're working the night shift, you're not dealing with anybody. Guess what? Those are positions where you're not dealing with the public or with employees. I say that to say this, and this is more of a discussion about being very careful. When you have a condition, please do not focus on the condition itself as it relates to you being disabled. You need to focus on what is the limitations that you have from that condition. I can't tell you when people say, I'm like, oh, I'm disabled. And I'm like, why? Oh, because I'm bipolar. That tells me nothing. And I'm not being nasty when I say this. I'm just saying I have a couple good friends who are bipolar. And they are active and they are very successful in the work, extremely successful. One I know makes 6 figures in the job that he does. And he's a corporate executive. But he's admitted that he takes medication in order to keep his condition under control. And I'm thinking, people fail to realize you cannot focus on your condition as an automatic slam dunk into getting disability. You need to ask yourself, how limiting is your condition? Do you take any medication for it? Are you getting any therapy for it? Are you going for any treatment? If despite those things you still have significant problems, those are things that Social Security wants to know about. So please do not embrace the whole notion that merely because you have a particular condition that you think knocks you out of the equation for various jobs, that Social Security can't find a job for you to do. Keep that in the back of your mind.